Collaborative working is so important. Coming to events like this, building up that shared working partnership, and it means taking those small steps together, you're much more likely to have a bigger impact.
Certain groups are more unwell in different ways, but we can't understand why, nor can we understand what will fix it unless we engage with them. The role of community research in addressing health inequalities is to get to know the problems, how to address them, and if we're allowed, to make sure that that change happens.
Research is part of the inequalities, and we need to tackle that by making it inclusive. When it's not inclusive, it's incomplete.
Diverse communities are interested in research, but most of the time they've never been asked to be part of a research study. So we want that not to be the case anymore. Today we had the opportunity to watch community videos all about health and care research across the region.
How might community research be improved?
Diversifying methods of finding people that represent that community. This place to find them is probably where they gather.
If no one approaches people in their own language, they are unlikely to engage.
咁我哋有啲心聲咧係講唔到英文出嚟嘅，講我哋心底話出嚟，同政府俾政府知我哋需要啲乜嘢，係呢個橋梁幫得到我哋。
From community research, people get to talk to somebody they recognise, someone that they trust, someone who speaks their language, perhaps can relate with experiences and challenges that they've had in terms of accessing services and also accessing research.
It's important because we're not being listened to, we're not being heard.
And we need to be heard.
Participants benefited in many ways from our community research project, and they even formed a new weekly women's wellbeing group.
What might your contribution be to make that change?
As I move forward, working with community researchers, I can see it as such a powerful way of getting the voices of underserved communities into the research that I do.
I like to hear from community researchers, then I also speak to health and care researchers to help them put their applications for funding in. I endeavour as my pledge to keep bringing those two groups of people together so that we can really design research that will make a difference to communities.
We would like to help professionals coming to the community to give talks about health-related issues. In order to build trust, I think you need to give back, and also this is to nurture the community and cultivate a good knowledge foundation for them. Working in collaborations across diverse communities is absolutely key to make this a success. What we're trying to do is set a network of organizations, making sure that they have the right connection and links with the communities. So the methodology is shared across them, and that collaboration is priceless for health and care researchers.